Hi guys, Dr. Robert Stevens here for the Men's Health Clinic. So, the topic of the day, aromatase inhibitors. Everybody should be on an aromatase inhibitor. Nobody should be on an aromatase inhibitor. Which one is it? You should only be on an aromatase inhibitor if you need an aromatase inhibitor. There you go, there's your answer. So, if you want to adopt a puritanical viewpoint on this, obviously you should not use an aromatase inhibitor. So your TRT should consist of testosterone and HCG. That's it. The reality is unfortunately, this modern world that we live in is pretty bloody unhealthy. So we do have a predisposition to aromatization. Now that comes about from liver dysfunction. If you're a bit of a boozer, if you're on any medications that again can cause some liver dysfunction, if your BMI is high, it causes overexpression of the aromatase enzyme. So, irrespective of how healthy your lifestyle is, what foods you eat, how much exercise you get, it's pretty hard to be that healthy that you can adopt this puritanical viewpoint on what should be testosterone replacement therapy. Now, less is more. We've been over this ad nauseum before. The purpose of testosterone replacement therapy is to optimize your levels. So you don't want to have high levels, you don't want to have fluctuating levels, you want to have optimal levels. And that's within normal physiological parameters. I've got a lot of guys, alpha guys, who come to me and go, I need more doc, I'm a big lad. And their free testosterones are running a little bit high, and I said, listen, let's just reduce your dose, trust me, trust in the process. And they come back and they go, my erections are back, my libido's back, my anxiety's gone. So less is sometimes more. Now, with regards to the use of an aromatase inhibitor, there are concerns about cancer and issues with your HDL and LDL. You titrate the dose according to effect. Again, you're not aggressive. These doses that we're administering for estrogen control in testosterone replacement therapy are minimal in comparison to the prescribed dose for their intended use of treating breast cancer. You should only use something if you need it. So we do prescribe aromatase inhibitors. I prescribe examestane, not anastrozole, because it's got a super short half-life. So, we know that testosterone aromatizes to estrogen. You're on a nice consistent dose, so essentially all I want to do is kill the aromatase enzyme for a short period to decrease the estrogen. So it allows you to control it without messing with your other parameters. So, anastrozole, people talk about a rebound, and the rebound thing is just because people are being mismanaged. So the half-life makes it long half-life makes it a bit of a pain in the arse. Because once you've recognised that you've got crashed estrogen, the only real way of actually of getting that estrogen back is obviously number one, stopping the anastrozole, and number two, increasing your testosterone dose. Now you were already on a testosterone dose that caused you to have a high estrogen. Now you've panicked. Now you have to reduce the dose or stop the anastrozole to get your estrogen back. And you've thought, okay, well, I need to increase my testosterone dose to compensate. It's just a real numbskull way of looking at things. And you hear so many horror stories of people crashing their estrogens with anastrozole. And, again, if managed properly, anastrozole can be an effective means of lowering your estrogen. But it's not ever managed properly. It's just, again, a sledgehammer approach to TRT. Slightly high estrogen. Here you go, buddy. Here's 0.5 milligrams twice a week. Oh, my estrogen's crashed. Oh shit. Well, let's stop the anastrozole. Let's increase your dose. Oh, and now we're in a worse place than we were before because we already knew that testosterone dose caused high estrogen. So, choose wisely. If, as I said, I don't use anastrozole. So, I use examestane for the reasons that we've already discussed. You want to be managed properly, and it always comes back down to this. Testosterone is testosterone. The choice of ester doesn't matter as long as you're managed properly. Aromatase inhibitors, doesn't really matter which one you use. You can use examestane or you can use anastrozole as long as it's effectively managed. Now, there are no certainties, so people react differently to different doses. So it makes perfect sense that you'd want to choose the one with the shortest half-life so that you didn't crash the estrogen. I've never crashed an estrogen. We titrate the dose up carefully. The sensible way of doing it, not the cookie cutter approach to testosterone replacement therapy that some people adopt. So, anastrozole, examestane, are they evil? No, of course they're not. Essentially, all we're using them for is to control the estrogen, but we're not doing it in a sledgehammer approach. We are making sure that you do all the right things to lower estrogen in the meantime, so that we can get you off the examestane or anastrozole. TRT is an evolving process. I don't mean that our practices are evolving, although the practices are evolving, but actually your physiology changes with time. So, a lot of guys come to us because they're quite heavy, they haven't been able to exercise. We get them optimized on testosterone. If they need an aromatase inhibitor, they're prescribed one. But we always highlight the importance of addressing lifestyle, nutrition, exercise, so their physiology changes. Lose weight, exercise more, then your likely need for aromatase inhibitor lessens. So we're always looking to get you onto testosterone anaphase, or doesn't matter which ester, and HCG, and have that as the goal. But sometimes it's not realistic. But you need to approach this sensibly and logically, and you need to act in the best interests of the patient in front of you. So I don't like prescribing an AI because I quite like the puritanical viewpoint, but the reality is sometimes they're necessary, and they are effective if used properly. It's just they're not used properly normally. So, here we go again. It's all about safe, effective practice. So choose wisely.